Hello, welcome once again, Dr. Ibe. Welcome back. This morning we talked about this dreadful and awful disease, sickle cell anemia, a very bad disease indeed. I mentioned on how this affected me personally regarding my late senior brother. So that's why I had to do a research on sickle cell, and I try to manage them aggressively in my practice because I wouldn't want what happened to my family happen to anyone. Sickle cell, unfortunately, is much more common in the black group, in our group more than the white group. It's common in the Afro-Caribbean origin, more than the white group. So that's why we advise all Afro-Caribbean patients of origin to really know their genotype, their status. That's very important. And if you have daughters or sons, I would advise that you get them tested before they get married. We equally mentioned about the genetic counseling. That is very important. Before you get married, most importantly, if you don't know your genotype, if you are in some part of the world where this is not done regularly and it's not done routinely, I would advise that you go for genetic counseling where you are checked to know if you're AS or AA, because if you're SS anywhere, you have the sickle cell disease. And yes, unfortunately, as I mentioned, it's a very awful disease. It's got lots of complications. In kids, they're always having infections, they're always having pain in the bone. And one of the very serious complications is what we call sequestrations. Sequestrations is a disease, very severe indeed, leading to severe anemia, where the red blood cells are being trapped in the liver or the spleen, leading to an urgent, rapid enlargement of the spleen and the liver. This is a very serious condition, which would require an urgent admission. And when it comes to adults as well, they could have this repeated infections triggered by cold or by dehydrations. That's why we advise a lot of fluid intake. And they could have these repeated infections, ischemias, blood clots that could get to the abdomen, giving severe abdominal pain, giving them pneumonia as well, and severe bone pain. I mentioned that I've got adult patients. Unfortunately, some of them are always in the hospital with crisis where they are managed as inpatients. And when it comes to management, I mentioned that if you have kids who have sickle cell, you make sure that they are covered with their vaccinations. They have to be on regular penicillins, folic acids, and pain medications, and under a pediatric hematologist. When it comes to adults as well, sometimes they may need regular blood transfusions, IV fluids to hydrate them. Obviously, sometimes IV antibiotics, to make sure, the infections are treated. They may have to be on regular opioids like morphines and so forth and so on. Blood transfusions are required in most cases. And equally, there is now a bone marrow transplant, which has shown to really work in patients with sickle cell disease. So they can equally undergo bone marrow transplant if need be. So I've had lots of interest on this topic. It is awful indeed. It's a bad disease. And, it is important. It's important that before you get married, you undergo genetic counseling. If you have kids, cousins, nephews, nieces, please make sure they know their genotypes before getting married. It's a dreadful, awful thing to have kids that have got sickle cell. It is something that may be difficult to handle indeed. Okay, so I felt I talk a little bit more on this. Yeah, once again, take care of yourselves, be safe, and play safe. God bless. Bye.